The National Competitiveness and Productivity Council in the Department of Finance is charged with monitoring the initiatives implemented by the government of St. Lucia under the Economic Recovery and Resilience Plan, ERRP, which were designed to combat the socio-economic impact of the COVID-19 pandemic. At the early stage of the pandemic, Medical Director at the Victoria Hospital, Dr. Lucia Eugene, lamented a very worrying situation for frontline workers, particularly nurses.
Some of the staff have been complaining about the level of stigma and discrimination they go through because they're actually taking care of persons who are suspect COVID cases, COVID-19 cases, or positive COVID-19 cases.
Natalie John, a registered nurse attached to the Viewfort Wellness Center, said the stigma and discrimination dished out by certain sections of the public had a profound psychological impact on her and her fellow colleagues, which was compounded by the increased death toll and workload brought about by the pandemic.
At the end of the day, it was there like, why are you doing this to me? I felt psychological effects. Why are you, I'm putting my life at risk. Why are you directly attacking me? That's how it felt for me psychologically.
Policy intervention number 21 under the ERRP provided duty-free concessions for the purchase of a vehicle for frontline essential public service staff.
For the first time, I was there like, thank you, Jesus. Honestly, being a frontline worker, I was like, thank you, Jesus.
Chief Economist in the Research and Policy Unit in the Department of Finance, Janai Leonce, highlighted the success of this initiative, which was a direct response to the transportation and discrimination issues faced by frontline workers in the early stage of the pandemic.
So we sought to remedy that situation and work with the all stakeholders involved to put a system in place that would allow for frontliners, healthcare workers to access vehicles, whether it be new, whether it be used, at affordable rates. And we are quite pleased with what has happened to date. Over the year and a half, we have had just under 400 persons benefit from that package. And that actually exceeds our expectations. So it means that there was a demand for the service, and it means that we have provided as many number of frontliners with a means of transportation that in some cases they would not have been able to afford with the duties or what have you, or they would have put off years into the future. So we're quite pleased with how it has worked out.
Nurse John was one of the first to take advantage of this initiative. The new vehicle, she says, has increased her overall work output and productivity and has positively impacted her quality of life and that of her family.
No, I wouldn't have been able to get the latest vehicle now if the concession had not been available. And in terms of it providing to the frontline workers, it was amazing to see that you're able to easily, with organizations and the assistance they provided, access the finance for payments and also to be able to say you have something that belongs to you.
The chief economist noted that despite the significant loss of government revenue resulting from this initiative, the government has been pleased with the outcome for all stakeholders.
Just shy of $7 million has actually been forgone in duties related to the initiative. So it means that there was quite a bit of uptake, and while the state recognizes that is a sizable sum of monies, particularly in this environment, I think it treated with a need that was there.
Nurse John encourages all frontline workers who are in a position to do so to take advantage of the concessions provided by the government to purchase a reliable vehicle. The concession was extended by the government of St. Lucia but is due to end in September 2022. For the National Competitiveness and Productivity Council, Glenn Simon reporting.